name is Christine Wheeler, and I am the BCBA supervisor at the New Hampshire Center. And today I am going to present identifying signs of autism. So, what is autism? Autism is a neurodevelopmental condition, and this affects communication, behavior, and social skills. Autism appears differently in every child, and it exists on a spectrum. So all children with autism are different. Why early recognition matters? Because the earlier that autism is recognized, we're able to help children learn these skills sooner when they're younger. It'll help to improve communication. It'll help to reduce frustration behaviors and to support long-term independence. When we're looking at signs of social interaction, we're looking at limited eye contact, rarely or not responding when their name is called, the preference to play alone, little interest in peers, and difficulty sharing or turn taking. When we're looking at communication signs, we're looking at delayed speech or no speech. So you may notice that your child isn't talking as much as they should be, or maybe not talking at all. Repeating words or phrases, few gestures. So they're not pointing, they're not waving. Maybe they're not understanding what it means if you're pointing or you're waving. Difficulty asking to get their needs met. A lot of times we'll see children, bring their parents to where they want to go to get what they need instead of using their words or their communication. Talking, but struggling with conversation. When we look at repetitive and routine behaviors, we could be looking at hand flapping, rocking, spinning. So a lot of those stereotypical behaviors that we see, lining up toys or objects, a strong need for routine, and getting upset by changes. A lot of times these behaviors are occurring in order for the child to have some sense of control. Sensory differences. When we look at sensory differences, we may notice that they're sensitive to certain noises, light, touch, textures. You may find that they're seeking, jumping or spinning or pressure, all of those things. And that's why a lot of times we need to kind of make accommodations for these children. We'll use headphones, we'll change the lighting in the rooms, we'll ask a child before we touch them, those kinds of things. What you might see at work: difficulty with transitions, avoiding group activities, big reactions to small changes, and trouble following directions. Developmental red flags. These signs will help to guide developmental monitoring. So at 12 months, if you notice that your child's not babbling very much, at 16 months, if you notice that they have no or very limited words, 16 to 24 months, you notice they don't have any pretend play skills. And then as they get older, you notice, a little bit of that lack of social engagement. They're not making eye contact with you. They're not reaching for you. They're not going near their peers or siblings. Patterns do matter. One behavior alone isn't enough. You need to look for multiple signs, and you kind of need to notice that consistency over time. Talking with families, share observations calmly, avoid labeling, focus on support, and encourage evaluation. It's important that when you're talking to a family, you're remembering that this is a super sensitive topic for them. So it's important really to just label what it is exactly that you're seeing and kind of take the feelings out of it, just those observations. Simple supports that help. Visual schedules, just pictures that kind of break down what their day is going to look like, what each activity is going to look like. Clear routines. A lot of kiddos, a lot of people in general thrive on routine and thrive on scheduling. Simple instructions. When talking to children, use less words. Use short sentences when you're talking to them. 1 or 2 words is typically sufficient when you're trying to present a direction. Always praise positive behavior. It's really, really important to praise what it is that we want to be seeing and not draw attention to what it is that we don't want to be seeing. Autism myths. One behavior alone isn't enough. Look for multiple signs. Notice consistency over time. And then we'll see the neurological differences. Strengths you'll often see: strong memory and creativity, strong visual memory, especially a lot of times just pairing language with visuals and pictures is so important. Honesty, a lot of times, a lot of kiddos will speak the truth. Focus on interests and unique thinking. When to seek support. If you notice delays across multiple areas, if you notice those behaviors increasing, if there are communication struggles, you're noticing that the child isn't able to communicate what it is that they need, you may inherently see an increase in behaviors because of that. And if there are family concerns. Key takeaway: early recognition leads to the best outcomes. Thank you.